Hey, I'm Fred, and the political determinants of health, Chapter 3, asks about the differences between political and social determinants of health. We're all familiar with the social determinants of health, which refers to conditions people are born in, like their lives and the work and the education and income and housing and healthcare access. And political determinants of health, on the other hand, refers to decisions made in the political scene that create the social conditions we live by. The laws, policies, and government actions that distribute resources and power determine who has access to things like healthcare and other essentials. Social determinants and health inequities often stem from choices made by those in power and not from neutral social factors. Recognizing the political determinants shows the mechanisms by which power imbalances are perpetuated and the role of advocacy and policy change in advancing health equity. Policies are usually politically motivated rather than grounded in scientific evidence because of competing interests and the influence of special groups who benefit from maintaining the status quo. Political agendas and public opinion generally overshadow the objective data, and politics usually shapes health policies in ways that support inequitable power structures rather than directly addressing scientifically proven health needs. Political determinants of health, Chapter 3, makes the distinction between social and political determinants of health. By focusing on the political determinants, we're encouraged to ask who's making the rules, whose interests are being prioritized. This reveals the health inequities that they're not merely unfortunate circumstances, but are made by the policy decisions generally without evidence based science. This gap between policy and science can be pretty wide, especially when politics are influenced by powerful people, lobbyists, and social trends. Policies on health equity are often shaped more by political pressures or the need to meet public expectations than by data driven insights on what would actually improve health outcomes. These policies that are not grounded in science, they would only provide superficial solutions that don't really get to the real problems. I have recently read a piece in the City Journal entitled How DEI Corrupted the NIH. This article suggests that the National Institute of Health, in its drive to meet with diversity, equity, and inclusion goals, has gotten away from its core mission to advance medical science. Many critics argue that this shift represents a sort of reparations repackaged, where DEI efforts focus more on achieving demographic balance than on scientific rigor. According to Rufo, prioritizing DEI has not only politicized the NIH policies, but it's also diverted resources from objective research, suggesting that the drive towards equity inadvertently lowers standards and the focus on demographic diversity. It focuses on demographic diversity at the expense of scientific advancement. From this angle, we can see that DEI shaping NIH policies in a way that leans towards symbolic reparations more than evidence based improvements. The policies prioritize specific demographics instead of addressing the scientific needs of all people equitably. I would argue that this reinforces a system of preferential treatment rather than creating genuine equity and equality. differentiating between policies aimed at social justice and those genuinely intended to improve health outcomes across the board raises questions about whether well meaning DEI initiatives serve political ends rather than advancing scientific and health focused missions. To understand the political determinants, we need to ask ourselves whether our policies are science driven or politically motivated, and whether some initiatives may perpetuate inequities under the guise of equity. Thanks.